Floor will be opened. Now I'll give the floor to Mr. Chen. Friends from the media, good afternoon. First of all, thank you for coming to today's press conference regarding the 6 newly confirmed cases of COVID-19 and the 6 asymptomatic cases. The detailed information already released this morning and October 10th at the official social media website of the Municipal Health Commission. I will not repeat it information. According to the plan and arrangement made by the CPC Central Committee and State Council, as well as the requirements from the municipal government, the national level and the local level also dispatched the expert team. So we have conducted a citywide, the NAT, and also epidemiological investigations. Right now, everything is going smoothly in a scientific base. I would like to highlight that in order to conduct this citywide testing, we have dispatched 210 people of 7 teams and 1,050 teams to select samples. All are in position and conducted work yesterday with the medics dispatched. Right now, more than 10,000 medical personnel also worked in this regard. Regarding the COVID-19 situation in Qingdao, I would like to give you the updated information. First, regarding the confirmed patients and asymptomatic patients, the national level and the local levels dispatched the expert team. So the respiratory disease, the TCM, nosocomial infections team, as well as the doctors from the infectious disease. They do everything they can to treat the patients. As of August 13, 3 critical cases, 3 normal cases. For the A3 critical case, they right now treated in Qingdao University Hospital, and 3 normal condition patients right now receive treatment in the 3rd People's Hospital of Qingdao. And regarding that, the 6 asymptomatic patients also hospitalized at the 3rd Medical Hospital. And we also organize the expert team to treat the critical cases with the customized plan. Second, regarding sweeping NAT in city of Qingdao, as of October 13, we have selected 4,022,300. So we have selected the 4235438 samples, and the 1945252 already showed the results. There are no positive cases showed. For the Licang area, we have selected 55,5096, and also based on the current results, so no confirmed cases. And for the Shibei, which we found the reported cases, we selected 556,587 samples. Right now, 286,520 samples already finished tested. No confirmed cases found. For Shiben City, right now we increased 133 stations for NAT. For Lichang area, we also increased to 553 stations. So we will do everything to make sure there's no big long queue wait for receiving NAT. Third, in order to do a solid work in disease prevention and control, today for the close contacts, in total 340 people received the 2nd round of NAT, all show negative results. For the confirmed cases, a taxi driver, Mr. Xiao, we have traced all the close contacts, which in total 52 people, right now under quarantine, and also received 2 rounds of NAT, all show negative results. For the above mentioned 52 close contacts, their close contacts, in total 89 people, also under our monitoring. So for the 388 people working for the chest hospital and also in-hospital patients, and also the 9 patients hospitalized, discharged from the hospital by the end of September. They all received NAT, all show negative results. Going forward, we will follow the arrangement and the guidance given by the experts from the national level and local level to mobilize the medical resources to everything we can to treat our patients and also to conduct the sweeping NAT as well as epidemiological investigation, make sure that the medical materials in place and the measures can be solemnly and smoothly carried out. Now the floor is open. Please raise your hand and also please identify your media affiliation before asking questions. CNR CMG. So till now it's already 3 days since the outbreak of the COVID-19 right now in Qingdao, so everyone would like to know what exactly the source of the transmission. So do we have exactly identified the source of infection this time? So I would like to take this question. Since the outbreak of the COVID-19, the city level and the municipal level CDC actually conducted epidemiological investigation, and also on October 11th we had the first round of the studies that the case actually related to the chest hospital, and on the 12th of October we also found 9 confirmed cases, all related to chest hospital. So with more and more study learned that the evidence showed that 6 confirmed cases and 6 asymptomatic cases all actually highly related to the chest hospital. And we also found, based on the more sufficient evidence, that there is less risks among the community level. China Daily. So why we conducted this citywide testing? Can we finish all the testing as scheduled? Because there are more than 10,000 samples we need to test it per day. Thank you for your question. Yes, indeed. The task actually, task is daunting. So yesterday, 2 a.m., so within 3 days, we actually identified 5 areas they should finish their testing mission within 5 days. The whole city should finish the testing, and the result will be released on due course. Yesterday was the very first day of the sweeping test. So the above mentioned 5 areas should finish all the testing missions, and 2 days later, the whole city of Qingdao should finish the testing. As you mentioned, it's actually a quite tremendous number of testing samples need to be got results. So we also work with the 5 surrounding cities. So we also paired up. So these surrounding 5 areas help us to conduct the sample selection and testing. This afternoon, we already sent the samples to these surrounding cities. So I also would like to take this opportunity to appreciate the city municipal government to mobilize all available resources to support Qingdao, and also thank you our brother cities for their great support. China Reform newspaper. I would like to know whether we have enough capacity to conduct this large number of testing. Thank you for your question. According to the unified arrangement made by the municipal government, actually the different cities in Shandong province actually dispatched medical teams to support Qingdao. So far, 1,260 medical people support Qingdao. Among them, 210 people of 7 teams, they actually dedicated for NAT. 1,050 people were sent to the different NAT stations to support the local medics for sample selection. So far, we have 3,600 stations working in different areas of the city, and also more than 9,000 medical personnel are doing the selection work. So far, the kits, the needed equipment, and other materials actually are in sufficient storage, so we do not need to worry about a lack of stock. So with the great support of the government and also the surrounding cities, we will have the confidence to finish the testing work as scheduled, and we will also release the information to you in our daily presser. Thank you. Many people would like to know when is the time and that they would like to receive the result of the testing. So for the NAT, after actually we finish the testing, they can check the results in our system online once it's available. With Qingdao Daily. So we also need to do NAT, right, if we need to be hospitalized. But if we go to a hospital for outpatient service, do we still need to do NAT? For outpatient service, actually it's not necessary to do so. There's no change to the outpatient service requirement. So you need to show your health code, take your body temperature measured. So green, cold, and also your temperature is normal, then you can receive the service. So if you need to be hospitalized, yes, NAT is needed. But if you also need to have a caretaker with you to be hospitalized, then the health taker also need to get one NAT test. Due to the interest of time, this is the end of the QA. If you would like to ask some more questions, please contact Municipal Health Commission. So you also can check the updated information at the Health Commission office, and we will release the information swiftly. And for the press conference, you also can check at the official social media platforms and also the official website. And this is the end of the presser. Thank you all.